What is up, guys, and welcome back to my YouTube channel. My name is Tin Chu, currently a newly fresh 4th year medical student. So today we're going to talk about how to honor your medicine clerkship. So internal medicine is the specialty of providing comprehensive care to adults, and it's actually considered to be one of the most important clinical rotation for your 3rd year, because this is where you're going to learn how to take a good history and physical, do a physical exam, how to read labs and diagnostic tests, come up with medical management. All of these things are very important to any specialty that you're going to encounter or that you want to do down the road, especially during your intern years and your residency. First 1, 2, or 3 your 3rd years is going to be you have your internal medicine basic down. Otherwise you're going to look like you're an idiot, during your residency. So given that the clerkship grade is, for me at least, was dependent on our preceptor evaluation and our shelf exam, we're going to talk about how I honor both. But before we go on, please hit that like button down below for the YouTube algorithm, and that's just gonna help my channel out a lot. And let's get into it. So first, let's talk about the in-hospital portion. For the typical day for me was, I get there pre-rounds, usually it happen around 7 to 8 in the morning. Sometimes you have to come a little bit early, you have more patients. But for me, 7 to 8, it took about an hour to pre-rounds on the patient. So after you pre-round your patient, this is when you're gonna start your work round. That's when you meet up with your residents and your interns. Preferably, you should discuss the management and talk to your interns and residents before the work round, and just kind of give them an update, and they can give you an update of the patients. So work rounds gonna start around 8 to 10 for me. That's gonna differ depending on the attending that we work with. Patient care tasks, so after 10, we're gonna divvy up the tasks that we need to do for the patient. Check with PT, OT, what order need to be followed up on, what imaging need to be done, medical record need to be get. That's what happen after work round. So that's usually around 10 to 12. That's what we're gonna do. And then at 12, we usually have lunch and a student lecture until 1 p.m. And then at 1 p.m. we come back with the team and we can reevaluate and see what else needs to be done and what the result were. So for the pre-round tips, make sure usually you're gonna get around 3 to 4 patients to pre-round on. If it's your first day or your first week, you maybe just take 1 or 2. So make sure you arrive early, give yourself plenty of time to see the patients without being rushed, because especially during your first week where you're still learning, the layout of the hospital, the EMR program, and the settings of the hospital. Give yourself plenty of time. You just gotta wake up a little bit early. And make sure you write down, get a piece of paper. I write everything down on my iPad mini. Write down all the information that you have so you can accurately convey it to the team during work rounds. And this is actually gonna be how you impress your attendings. I literally just kind of screenshot all the lab results and everything, or you have access to the EMR on your phone. Make sure you pull those up during work rounds. One of the musts that you gotta do is that you gotta review your patient's charts for any new progress note overnight. Keep track of the hospital course, because you gotta take it like that's your patient and you need to know everything about that patient. So you look at the progress note, you look at other physicians' consult notes, even nurses' notes overnight. Literally you gotta know everything that happens overnight since you weren't there. Look at any new orders that's in place. Another thing you can do is also check in with your interns, because sometimes they get new updates from the overnight interns or the overnight residents that actually might be really beneficial to you. So make sure you can check. So after you go see your patient, you can check with the intern to see what else is new. Another important thing that you gotta know is that you make sure to perform. So don't just gloss over. This is my big mistake when I first started with my rotation. Don't gloss over the physical exam. Use this as a learning opportunity. Make sure you always perform the cardiac, the respiratory portion, and the abdominal exam for every single patient. Doesn't matter what she complains, because you want to listen to a lot of heart sound. Even if it's normal, that's not what they're complaining of. the more normal sounds you listen to, and the lung sounds and the abdominal exam, like the more normals that you do, the more likely you'll pick up the abnormals later. So it's actually really good if a patient comes in with a normal heart and lungs, because this way you can know what normal is. Again, this is the best learning opportunity for you. And an attending once told me that you must listen to 10,000 normal heart sounds before you can get good at differentiating abnormal ones, which makes absolute sense to me. Always check the EMR for the newest update lab results and imaging. If the vitals are not updated in time, make sure you do them by yourself. Like, this is my mistake in the beginning. Like, sometimes you get there so early, the nurse hasn't done the vitals yet, and you forget to check it later during work rounds, and then you just look really stupid. And just like, especially if there's an abnormal vitals, and you like, the attending's gonna grill you. They're like, why didn't you report this? So if the vitals not in yet, do it yourself. You know how to check for heart rate, you know how to check for respiratory rate, you know how to check blood pressure. Like, just grab one of the cuff from the hallways and bring it in. Make sure you analyze and synthesize the information you got and come with your own assessment and plan. And then this way, this is how you learn. And this is after you come with your, like, for me in the beginning, is I literally just, all I have is like 1 or 2, problems, because we just not trained to think of all the problems the patient has yet. Just 1 or 2 is fine, and try to come with a plan for them. Look up UpToDate, look up AMBOSS, and write your own plan. This is how you learn. You're gonna match this up with the residents and attendings assessment and plans later. So next up, we have workaround tips. So this is actually one of very crucial times. This is one of the few times where you actually get to show your attendings what you're made of. This is one of the rare times that you actually get to interact with your attending. A lot of the places you have a lot of med students, a lot of residents, you have a lot of interns. It's actually really tough to get one-on-one time to attending. This is your chance to shine. So make sure you make it count by following these tips. Make sure you learn how to present a patient before you start your rotation, okay? This is my mistake. I didn't watch this video when I first started, so my presentation was horrid. So watch the video that I link in the description. That's gonna the guy, he's really good at explaining it and how to do it. So make sure you have I'll go over the gist of it, so write this down somewhere. So you make sure you have a patient identifier, which is the one-liner to remind the attending about the patient. Any subjective changes overnight, what the patient or the nurses reports. You're gonna have objective changes, which is gonna be your most recent vitals, your total fluid in and out, or your blood glucose checks, etc. Then follow along that, you're gonna do a physical exam findings. So this can be always include the heart, lung, and abdomen exam that we talked about, because you always do it, right? And also the lower extremity exam. Those are pretty, you can always do those too. At least include those, and any pertinent exam that pertinent to their chief complaints. After the physical exam, present any lab test results. So only give them the new lab result. Don't give them the old ones unless it's like related to them. Maybe the creatinine was high before, now it's dropping down, trending down, or the white blood count was low and now it's trending up. So then you can give the old result, but usually just get the new lab result and the new imaging findings. And then you want to discuss each problems in the order of importance. The most important, the most pressing problem first, and the least later. And you also want to give the assessment plan with those problems. So one of the good things you can do is ask your residents and interns about your attending's preference for the oral presentation to determine if they want to if it should be brief or extensive for old patients versus like new ones. We'll talk about the new ones later, but right now it's just kind of like follow-up patients. So some attendings might be different. Maybe they want like a comprehensive physical exam finding, where some just want like a pertinent physical exam. So get that down with your residents. Make sure you bring any new studies or imaging findings, ECGs, PT recommendation with you 2 rounds. Usually I just take a picture of the recommendations on my iPad, so I have it ready. Or imaging, take a picture of the CT or chest X-ray reading interpretation. One crucial thing that you gotta do is that you gotta present your own assessment and plan to the attending. And this was like my mistake in the beginning, where I give the subjective, objective, lab findings, physical findings, but I always stopped there and I never really give the assessment plan. Crucial tip is that you have time in the morning, run the assessment plan through with your residents if they have time for you. Usually, you can ask them and they'll be really nice about it, and they can kind of give you, oh, hey, what do you think of my assessment plan for this patient? Like, what else would you do? They can give you tips, and so that way, when you present to attending, you're gonna shine like a star. Ask the attendings updating their assessment plan for any of the patients on the list, not just your own patients. Make sure you write down what the new changes is, or what the new plan is gonna be, or whether you're gonna be discharged home with a disposition is, for everybody. This way, when you guys come back to the room later and divide up the task, because you're not just gonna be doing tasks for your own patients, you're gonna be helping out with everyone else on the team too. You'll be more on the same page with everybody, unless, because you don't write it down. They're gonna come talk about this one patient, you're like, oh, you're gonna be lost. So make sure you keep, and it's also gonna help you, train you to help kind of like keep track of all the patients, on the list, but not be responsible for all of them. Because when you get to be an attending in the future, you're gonna be seeing all like 20 patients, and you're responsible for all 20 patients. So this is a good time to practice and learn. While the attending is doing this, make sure this is why coming with your own assessment plan is good. If the assessment plan differs from what you wrote down earlier in the beginning, so this helps you ask the good questions that's relevant to your patients, relevant to the medicines. You're not worried about it being a stupid questions. It's gonna show the attending that you're interested, because attendings love getting questions asked, because it shows that the students engaged and interested. It helps prevent you from just drifting by the rotation unnoticed, because you're actually speaking up, right? And it's gonna help you boost the evaluation grade. Very important. Okay, so next part we're gonna do is the on-call tips. What do you do when you're on call? So this is actually a great time for you to learn to see a new patient and write up a brand new history and physical. So these patients will usually be seen on rounds for the next few days. So if you're very thorough about the first time you see them and get a good medical history, it's actually, you're gonna choose to stay with that patient. It's gonna make your life a lot easier for the next few days, because you already know a lot about the patient. You don't have to spend much time pre-rounding on them. For these, you gotta make sure you know the patient like the back of your hand. You like look up all the previous medical record, previous imaging, ER courses, prior medical problems. The more you know, the better. Especially when you present to the attending the next day. They're gonna be asking you tons of questions. Make sure you know the answer to it. If the resident tells you to go home early when you're on call, just say, thank you for teaching me today. I'll see you tomorrow or the next day, whatever. Just go home and take a break and take a rest. Okay. Now a lot of the time the residents just kind of want some time to themselves too, and not having to worry about, oh, I gotta teach the medical student or something. So if they give you time to go home, just go home. So writing notes. Actually I noticed that it varies a lot from resident to residents, but the basic part, you want to just make sure you have the SOAP, section, subjective, objective. Don't miss anything of the past medical history and the ROS and everything. But when you start a new rotation, or you have a new resident, a new group of residents, kind of look up the previous charts and previous notes and kind of copy the templates, and that's gonna, so they don't have to change as much, because when you're writing notes for the patients, they're gonna have to go in and kind of edit everything again. So the more that you keep it similar to their own style and templates, the more they'll appreciate you for it. For the first few days, if it's a new group of residents or interns that you're working with, ask them to just go over 1 or 2 of your notes for the first few days, so they can help you see what you changed at the time, and help you learn and improve on your own note writing, and also see the different styles of each residence. And then you can kind of take from those residents and make it your own, and write your own notes in the future as a resident yourself. Alright guys, next part we have is going to be the shelf exam prep. So this was really the hardest shelf exam for me, because it has the biggest question pool in UWorld, a lot of medicine. So I did not finish all the questions. I did not finish all the medicine UWorld questions. So just let me know that it's gonna be okay for you. You don't finish, because you're still gonna be able to honor your shelf exam if you don't finish UWorld questions. So don't freak out. You on track, and it looks like you're not gonna finish it because you're gonna be busy with rotations, not gonna have time to do all the questions. So it's the most content tested on step 2 CK. So make sure you know this is a good learning time for you to learn the most as you can when you're preparing for the shelf exam, so you have less to do later doing dedicated. So all I did was a bunch of UR questions. I think if I did finish all the questions, maybe I could have scored a little higher on the test, because I barely squeaked by to honor the exam. I use online method. So usually for all the rotations, what I do, and you're gonna see this for all of them, is I just binge watch a bunch of online method videos before the rotation starts. However, now that I got into Boards and Beyond Step 2 later during my clinical years, I actually suggest, I really like Boards and Beyond. I like Dr. Ryan's style of teaching. It's really the same. If you like Boards and Beyond when you're taking Step 1, his Step 2 videos are also very good. And I also feel like the online method videos are a little outdated with other algorithms and the new treatment guidelines and stuff. So if you can, try to watch the Boards and Beyond Step 2 video. Just kind of binge watch it for the first few weeks or so, and then hammer UWorld. And then my biggest staple, as you all know, is going to be Anki. The deck that I'm using, the Dorian Retag deck, and I just go through it as I do the online method video. So this could be a good reason for why you want to do online method instead of Boards and Beyond. But if I could go back, I don't know, I think I would just not do online method, just watch the Step 2 videos, not do the Anki cards from the online method videos, and just make incorrect UWorld Anki card. And then last and not least, do your practice NBMEs. I think there's like, I want to say 3 or 4. I don't think I finished all of it. I think I did 2 or 3. Alright guys, so that's what I have for you guys. So remember, internal medicine is the backbone of medical education. So, and it's the foundation of all good physicians. So you want to be good physicians, you gotta know your internal medicine. Make sure you take your time to read about the diseases that you encounter in the hospital and how to treat them. If I could go back, I preferably would, I'm gonna start doing it now, but let's say you learn about pneumonia or something, make like a 1-page thing about pneumonia and keep it somewhere. Take a picture of it so that you have access to it later on during your residency, because you can have this cheat sheet of pneumonia and all the management and the differential diagnosis, how to manage the patients. That's going to make your life a lot easier during residency. So by the end of your IM rotation, hopefully you'll be at least an expert in probably 5 or 6 topics at least. That's pneumonia, the CHF, all the common things you see literally every single day. Every new patient, you're probably gonna see CHF patients like daily. So you should be an expert in CHF. And it's just gonna make your Step 2 CK that much better, because most of the Step 2 questions is gonna be asking you like next step in management, next step diagnosis, how to treat the patients. Don't be a jerk in your rotation, be a pleasant human being, okay? Treat others with love and respect. Key. Learn from your patients, and make sure you utilize your downtime wisely doing Anki and trying to do UWorld questions. So if you find this video informative or helpful in any ways at all, any shape or form, please, again, give me a thumbs up down below, give me a like, comment down below. Anything that you found helpful or any tips you might have for future students, because obviously I don't know everything. You guys probably know more than I do. And subscribe if you want to see more contents like this. I'm gonna have a whole series of how to honor all your clerkship rotations coming for you guys. Thanks for watching, guys. Until next time, peace out.